everyone, and thank you for joining us today for our Archives Unlocked online series. This evening's topic is chronicling COVID-19 in Singapore through oral history. We are happy to have with us Mark Wong, Senior Specialist Oral History at the Oral History Centre, National Archives of Singapore. His interviews cover the Japanese occupation, education, sports and the performing arts, and he is presently leading the OHC's project on Singapore's COVID-19 experiences. He is also Vice President of the International Oral History Association. He will share about the National Archives of Singapore's Oral History Project on the COVID-19 pandemic in Singapore. He will show the value of oral history when documenting a crisis and highlight the innovative ways he and his team explored in order to carry out this project under difficult circumstances. Mark will also highlight some preliminary findings from the project. Now, without much further ado, I will turn the time over to Mark. Mark, please.
Thanks, Anna. Okay, I hope everybody can hear me fine. My name is Mark. I'm from the Oral History Centre of the National Archives of Singapore. So we're a little department. There are 14 of us. So just wanted to also just acknowledge my 14 colleagues who have been helping me on this project, 4 who are in the core team and who have worked with me through this project. Okay, so we've all assembled here today through a very strange medium, something that would have been pretty unusual, even though, the technology existed, but it would be pretty unusual just, more than a year ago. And of course, we know that our lives have changed very much in quite drastic ways, some more than others, but it's affected all of us. So COVID-19 is some kind of, it's a kind of historical event. And we kind of know, sometimes events happen and we're not so sure what's the impact of it. But with COVID-19, I think the impact was felt pretty strongly, pretty fast. I think this also influenced us in the way that we also then started to think about how we wanted to document and to record this period that we're living in. I'm going to start off by speaking personally. So I'm going to speak about my own experiences, some of my own experiences over the last year and a half. This was a picture kind of like in my neighborhood, just on the first day of circuit breaker. And, it's a kind of like a sight that you wouldn't expect. It looks like maybe something else happened. And then they had to cordon off the space, but it wasn't. Every part of Singapore was like that. And I wanted to take a photo of something that's very, very particular because what I know is that all of you listening in would have had your own experiences, would have had your own images in your mind or photographs on your phone of this circuit breaker period, of the changes to the landscape, to the way we interact with people. And all of this has been so rich. But I also wanted to show you this photo and to get you to think about this past year and more, because our relationship and our feelings towards, I think COVID-19 also has changed over the course of time. Whereas it first felt very novel. And I remember showing this photo to some volunteers that we were training, and the responses were actually quite different from when I show this now to other people, because we've kind of like almost normalized some of these things that at first very novel, very unusual. And these are just more photos of that, particularly of that very intense few months in the middle of the year when we went around and we had to queue with social distancing. So a lot of queues started forming. When we found that queues started to become a form of like sticker art around the city. When we were staying a lot at home, some of us with few companions, some of us with more companions, some of us with animal companions, some of us never fully knowing how our pets might have been living and spending their day at home, until we also were made to stay at home and be with them for the whole day. Yeah, and of course there are a lot of cooking experiments. And on the rare occasions that I actually step out of the house, I saw changes to the city. I saw that also visible displays alluding to COVID-19. Of course, here on the far right, a huge billboard or huge screen celebrating and thanking the healthcare heroes. So I'm sure some of you have had similar experiences. Some of you also have had very different experiences. And I think one of the goals, of trying to capture or trying to record this moment of history is to understand what are some of the similarities and what are some of the different kinds of experiences that we've all experienced. So what happened is last year, I think April was the circuit breaker. Very shortly after, in May, the National Library Board, jointly with the National Heritage Board, announced that we would be actually launching a joint project, and we called it Documenting COVID-19 in Singapore. And what this project really sets out to do is to make sure that we are able to document and collect contemporaneously, meaning to say that we don't want to wait until too much time has passed, because things would have been lost, right? Things might have been misplaced, and also to get people to think consciously about finding ways in which we can record our experiences. So the National Library collected and made a public call for people to submit things like diary entries, photographs, and other print materials such as maybe flyers that they receive, maybe kind of vaccination flyers or things like that. And our colleagues at the National Heritage Board were in charge of collecting more object-based things. So gadgets, gimmicks, masks. So all these things that were previously rather, maybe not so common, suddenly infiltrated our lives. And we wanted to make sure we record it. And I think a very, very early outcome of this collaboration has been an exhibition at the National Museum of Singapore. It's called Picturing the Pandemic. And besides this visual splendor that you see here of lives around Singapore, of activities, we also had the museum also using some of our oral history materials to showcase and to demonstrate some of oral retelling of some of the experiences that people went through during the COVID-19 pandemic. But I wanted to just check with all of you, and you can write in the chat box. Because we're talking about history, I actually wanted to go back a bit further back than last year. In fact, I wanted to go back to 1918. And does anybody very, very quickly, just within the next 10 seconds, know why I'm picking 1918? So some of you have mentioned already immediately Spanish flu. I don't like to call it Spanish flu because I don't like to associate it with countries. So we call it actually you can call it 1918 influenza pandemic, 1918 flu. The entire period that kind of afflicted the globe actually was 1918 to 1919. Now, the 1919 influenza pandemic was it's a very strange and unusual kind of phenomenon. And partly because a lot of historians have described it as a forgotten pandemic. And what it means by forgotten pandemic is that when it swept the planet, it caused huge numbers of infections and huge numbers of deaths. So we're talking about an estimation of 1/3 of the globe being infected. At that point in time, it was said to be 500 million. And we're looking at 10% of those, 50 million, passing away. So that's a huge death toll. And in fact, just a year, in fact, was the end of another event that had a great death toll, and that would have been the Great War, or the First World War as we know it now. And what's amazing is that although the death toll of the influenza pandemic was far greater, it was slowly, it was not written into history until a lot later. Historians didn't write about it. The people didn't want to talk about it, right? And it's only over the years that we've actually gone back to it. And it's then only over the years developed its own kind of history, right? The history of remembering the pandemic, the influenza pandemic. And then it's taken on new meanings. So one article that I learned a lot from is this article from Phillips from 2004. He gave a number of reasons why this was a forgotten pandemic. And the reason why I'm really explaining this is actually this was something that came to my mind very early on in thinking about COVID-19 as well. And I think there are a lot of lessons that we learn about from this particular experience and why it's so important then to make sure that we document COVID-19. So the 18 and 19 influenza pandemic, the first reason why it was forgotten really is because it was overshadowed by the Great War, right? So after one disaster, another disaster, and people didn't want to talk about it, dwell in it, yeah? And when people were recording history or writing about history, people focus on the human war instead, yeah, of the kind of the non-human war. The second reason is that it swept the globe, it didn't return. So it actually, in that way, reminds me of SARS, right? So it didn't become endemic in the population, right? It's not something that we are kind of like facing now. It's something that actually swept through and ended. And because of that, people were able, in a way, to move on. And they didn't want to talk about it. The third thing is that people couldn't make sense of it, right? So again, it's a different times, right? Media is a lot slower, right? There's a lot of local news, but media is a lot slower. People couldn't understand, you didn't get like statistics in real time, not like we're getting now, where you can Google and, you can find all the current caseloads and all the current mortality in all the different countries in the world. People couldn't make sense of it. It was difficult. Information was hard to come by. People couldn't grasp that magnitude, that it had caused such a wreckage on the earth. And people couldn't also connect to the fact that this is just meant to be influenza. It's meant to be like, something that you catch a cold and then you recover from it, not to die from it. So people didn't understand it. Fourth reason is that there were not enough household names among its victims, right? So again, as we know, famous people, celebrities, these things will make people pay attention. But if it's ordinary lives, we may not pay as much notice. So these are the four reasons that are typically cited. I think Phillips lists three others which he found important. Number 5, he says, it was overlooked by historians because of essentially political conceptions of history. So back then, the idea of history was the wars between nations, was the rise and fall of kings. It wasn't about people dying of disease, right? So what's really interesting is actually how the idea of history has changed over time. And we've actually incorporated, or we actually understand that there are other aspects of human society that are important to also consider as part of our human history. Sixth reason is that the impact was relatively light in Europe and North America, where you have academies that define what scientific history was. What I found out about the 1919 pandemic was that the death rates actually were highest in India, South Africa, Indonesia, Mexico, Russia, and China. So out of the centers where so-called scientific history was being defined. And related to that point is the last point, where since the days of Pasteur, Louis Pasteur, and all these kinds of scientific discoveries that were taking place in Europe, there was a very triumphalist brand of medical history. And it was one in which the pandemic overturned, but people didn't want to confront that. So they didn't address it. Okay, so the pandemic exposed, once again, human frailties, our vulnerability to disease. But people didn't want to address it. So this is some of the reasons why it's a forgotten pandemic. And what is important, I think, from here on is then to understand that, the understanding of the 1918 and 1919 pandemic actually changed over the course of time. It went through 3 distinct phases that Phillips writes about. And what these phases are is, first of all, the epidemiological lens, which is that initially people were only writing about it through the lens of the study of medical history and disease. So it was a very utilitarian kind of a study. It didn't consider the pandemic as part of a larger history. Historians then weren't interested in the social, the cultural causes, the social and cultural dimensions, or the consequences. As a result, it was very limited. In phase 2, we're looking at now the 50s, 60s, 70s, and in which there was high drama. And why high drama is because people had started picking up on the pandemic again. And the reason for that is because there were other pandemics that took place, or epidemics that took place, right? There were some epidemics that took place in the 50s, 60s, 70s, various influenzas again. And what happened is that when these came up, people needed a reference point to understand what was happening with them in their present day, in their contemporary times. So people started to look back at the past, and they looked at the pandemic of 1918 and 19 again. And why high drama is because people played it up, right? So what we found is that amongst a number of histories actually starting to be written about the pandemic, is that there were even commissioned writings, commissioned histories by pharmaceutical company that was involved in manufacturing the anti-flu vaccine. So they actually tried to write about it in order to understand it. But in so doing, it was a very dramatic account. Now, one particular account is rather important, and that is from somebody called Richard Collier. And he wrote a book called The Plague of the Spanish Lady. And that was written in 1974. And why that's important is that whereas earlier histories actually made use of contemporary documents, meaning to say that they made use of things like newspaper reports, written reports. What Collier did is, well, not exactly oral history, but he spoke to survivors, people who remembered the times. So by then, we're looking at about 50 years after the pandemic. He got them to actually write him letters, chronicling the experiences, remembering the experiences. And so while not exactly oral history, not that they orally delivered it or it was orally recorded, but it was people actually giving firsthand experiences, firsthand accounts of the experiences. He actually collected these letters, and very, very generously, he actually shared these letters with other researchers so that better histories could be written. So that was a very significant development. And in phase 3, the next phase, what you found is that again, as I mentioned earlier, the earlier conceptions of history were very narrow, but now it was broadening up. So there were emergence of new subfields. So social, environmental history were emerging, and later the social history of medicine. And these became academically respected subdisciplines. So what happens now is that epidemics are no longer a part of just a kind of like non-mainstream event or some kind of quirk that you don't have to account for within a general history, but it becomes part of mainstream history, and we start to take it seriously. And so from the 50s, 60s, 70s, as I mentioned, and even the 80s, even when we had the phenomenon of AIDS, HIV, and subsequently when SARS came about, when the H1N1 pandemic came about, and of course now when COVID-19 came about, we find that we always go back to the 1819 pandemic. So I find this a very important starting point when we conceive of the oral history project, because there are certain lessons for us in which, first of all, we have to ask what actually becomes history, right? We know that the pandemic initially was written out of history. It wasn't remembered as part of history. And just because so many people died, we realized that it doesn't mean that this event then will become history. It could very well have been forgotten. So we learned that because of that, we realized that history is not just about everything in the past. It's not just, oh, this happened, so therefore it's history. It's more than just that. It's actually a particular narrative. And when I say narrative, it means, narrative comes from the idea of a story. And history is a story. History is a particular trajectory, it's a particular development. Things are put in and things are left out. And how it is developed is because of many, many, many different factors. It could be political, social, historical, and other factors. So we need to be cognizant of that. So bringing it to our present times, to conceptualize a kind of a documentary project of the contemporary, to say that we want to remember, is a very powerful statement. It says that we are committed to remembering this because it's very important to us. We understand that it's affected many of us, it's important to us, and we don't want to forget it. And the second point I think that is important about the historical pandemic, is that over the course of time, the meanings change as the contemporary society grappled with the past. And so we need to know that historical events also will undergo reinterpretation by every succeeding generation, which is why it's really important that our generation collects authentic primary sources for them to properly contextualize the event when they revisit it in the future. Because when you lose authentic primary sources, you lose context, and people in the future might interpret it in a way that is ahistorical, or not taking into consideration the particular historical circumstances of our times. So that is the history lesson for us all that I wanted to share. And I found that this gave me a very firm grounding in thinking about oral history and COVID-19. So why oral history and why oral history now, right? People can write histories, through text documents, through visual imagery, etc. Let's talk about what is oral history first, so that we have some kind of shared understanding. When we talk about oral history, it's not like a media soundbite, where someone says some words and then that's it. When we practice oral history, we do in-depth interviewing. It's also systematic, in which we prepare outlines of areas that we want to cover, and we also give interviewee space to also talk about things that are important and meaningful for them. So this way, it becomes a very rich and contextualized interview, in which it then provides, very, very rich material for the understanding of not just the phenomenon, but the context around the phenomenon. We also interview people with personal experience. So these are people with direct, they went through it. Something might have happened to them. They might have been participants in a particular event. They might have been also, or they might have been eyewitnesses, right, at the front lines of history, so to speak. So it's not people that basically, it's not just hearsay. It's not that, oh, my parents told me this. Yeah, it's people that actually lived through it. Third thing is that interviewers are trained and well prepared, meaning to say that they have gone through the material, they have done research, they have studied up on the context, and therefore they are trained to ask questions, ask meaningful follow-up questions, to probe in areas that are historically important. The fourth point is something that you find some variance in the oral history world. Not all oral history interviews sometimes are recorded. And there are several reasons for this. Sometimes you cannot record if you want to get the interview. So people only take notes. But for us, we do recorded interviews and they're preserved for posterity. And this is that commitment to making sure that we have authentic primary records for the future, for people in the future to look and relook. And oral history is very ethical in the sense that our interviews are briefed on what we're going to talk about, what's the scope, and they're also given a consent form in which they agree to be interviewed, and they agree on the conditions in which the interview can be used thereafter. Okay, so all these things are some of the basis of what we talk about when we talk about oral history. So the thing about COVID-19 is that COVID-19 had changed completely the way we do oral history. Not completely, but changed in some ways the way we do oral history. I would want to say that it's not fundamental. I think we've held on to certain things which are fundamental, but certain things actually we've had to maneuver around, right? Because of some of the challenges that face us during oral history. One of the things actually about the oral history we're doing at COVID-19 is that it's a particular kind of oral history. Typically, oral history and traditionally oral history is something that is done in retrospect. We tend to do something that's called the life story approach, in which we talk to a person and they recount the breadth of their lives from their youngest days, earliest memory, to their present times. And through that, you get a very, very rich kind of biographical life story. And you get all the elements of their lives coming in, weaving in together, from family to work to particular events, right? So that's retrospective. So people reflect on a time. So some time has passed between event and interview. Crisis oral history is something in which we find that there's value in interviewing very, very, either in the midst of something happening or very, very soon after the crisis. And why that has been a growing trend in oral history is because oral history has been used more and more. And people find that it's very valuable in interviewing people about all the kinds of crises that might emerge, right? So if you look at pre-COVID-19, and particularly all around the world, right, you have oral history into projects on refugee crisis, on war and displacement, all things like this. Why crisis oral history? Because oral history is important because through these in-depth interviews, right, we find that, and through in-depth interviews with protagonists, with people that live through things directly, it helps us actually find out the meaning of an event through these different interviewees, protagonists, people who might have different perspectives, but through interviewing different people with different perspectives, you kind of get, a more complete picture from different perspectives and from different dimensions. We learn how events unfold, we learn how people respond, but the wonderful thing about oral history, as opposed to other kinds of records, is that you can also question them. So you can ask them not just about what happened, but what were they thinking? So what were their motivations? What were their dreams, their desires? What were their responses and reactions? So it's a very, very powerful tool that people have been using. And I say that it's a close cousin of journalism because sometimes people say, oh, isn't what you're doing just like the media? Aren't you doing an interview? I mean, doesn't the media do a very good job already of interviewing people on COVID-19? Why do we need to have an oral history project? And I would say to that we are a very close cousin of journalism, and journalism has very, very great value to society. good journalism has very, very great value to society. And people often say that journalism, in fact, is the first draft of history. And why is the first draft of history? Is because it's there on the ground, right? It's daily reports. It's there interviewing and establishing these facts about an event. But there are some key differences when we talk about crisis oral history and journalism. Yeah. So one key difference is that with journalism, there's actually a lot of framing, a lot of editing by a writer, by a publisher, by an editor. Okay. Whereas oral history is something in which we give a lot of latitude and a lot of space for interviewees to develop their story, their memory, what they recall, their retellings, and we give them a lot of space to answer in the way that they wish to answer, in the way that they wish to describe and portray their own experiences. You do find with a lot of journalism, you do find that there are times when there are occasions when journalists need specific answers, right? They might ask very pointed questions because they had in mind a kind of story that they needed to write. In oral history, we don't have a conceived kind of like story we have to write. Our goal is really as a kind of a conduit for the interviewee's story to emerge. Okay, so these are some key differences, of course. So let's talk about our COVID-19 pandemic oral history project. And our aim really was that through this period, we wanted to use oral history methodology to record experiences, but also emotions. And I failed to mention earlier that one thing about crisis oral history is that the emotional element is very rich. When you're interviewing so close to an event, you find that people's emotions might still be raw. They remember certain things more through the emotions, maybe more through the body than maybe through the more rational parts. Yeah, so it's important and it's good that we come in early to record these. And actually, in fact, this way of conducting oral history also lends itself to more possibilities after. Meaning to say that if you don't come in early, you might lose all these more raw parts. But there's opportunity actually to revisit interviewees. So there's the opportunity for longitudinal kinds of interviews. And what this means is that then you can trace and track people's responses over time. When the circumstances change at a different part of the crisis, their thinking might be different. So this is actually very, very, very rich and ripe field. So as I'm mentioning, we want to record the emotions, the reflections of the COVID-19 pandemic in Singapore. Now, these are the list of kind of like areas, key areas that we wanted to record. We're not interviewing all of them at one go. This is actually a 2-year project. We started last August, and we've started by focusing actually more on members of the community, as I'll explain to you in a bit. But this whole list really is very varied. And because we know that COVID-19 affected us very, very, very in many, many different ways, and in all strata of society, we know that also we need a very broad kind of like broad sweep of society. So from government, from official responses to the pandemic, from our healthcare responses to others in the official, giving official responses, to also those who have to operate essential services, to those who are involved in aid, in community work, in social work, and to help the more vulnerable communities, to people who were affected by COVID-19 maybe more directly in the sense that they caught it, or they might have been suspected, they might have had quarantine orders, stay-home notices, and in fact, to almost everyone else of us, in the sense that all our lives were changed and affected, and all of us have in a way, something to share, some kind of experience to share about COVID-19. So when we're talking about the voices from the community, from this wanting to document the multivariate responses of the many, many different people within our community, within our society, we knew also that we had to somehow actually involve the community in recording and in collecting these stories. And so, and this is also in line with the larger, what was happening with the National Library Board, which was having this public call for people to submit materials, right? Photographs, videos, etc. So we also wanted to involve the community in the oral history collection. So what we did is that we wanted to basically get community volunteers. But immediately, of course, you know that there will be some, there are spanners thrown in the works, which is that how do you mobilize people to collect interviews during a time, during a time of pandemic, when there's social distancing, when there's, you shouldn't be actually meeting people, particularly people who might actually be of an elder age, or of people, who might be from vulnerable communities. And so one of the things we thought very hard about actually is how to conduct interviews during this period, both by volunteers, but even by ourselves, by staff, um, and other people that regularly interview for us. The thing about oral history is that there has been developments over the years to look at video conferencing software technology, but oral history practitioners or historians have generally, until COVID-19, been fairly reluctant to do kind of remote interviewing, and for good reason. One of the reasons is immediately that we never meet the person we interview. How do you then form rapport? So oral history is all about rapport. It's all about whether or not the other person, in a way, trusts you, understands your project enough to then share with you and in a way confide in you. Sometimes the most successful interviews are the ones where the interview, after you hit stop on the recorder, they tell you like, wow, I've never even shared that with my family before, with my children before, but I felt like I had to share that. So oral history interviews can be pretty intimate affairs sometimes. How do you do that over remote conferencing, right? Other problems with remote conferencing, which all of you would have experienced, I think, over the past year, is video lagging, talking over one another because of these video lagging, all these technical issues. So all these were a problem that we needed to address. So what did we do? What we did for staff actually is that we started to do a lot of research on remote interviewing. We found out best practices, basically. We knew that in this situation, actually, and I would mention that in other parts of the world, actually, there were calls actually to halt all interviews. So basically, there were parts of the world that basically advise all oral history projects to stop. If it's non-essential, stop, and don't do it during the pandemic, because what's more important than ensuring the safety of all, right? But this was, so we paid attention to that, but we wanted to make sure that the interview could still go on, because we also knew that time is of the essence, and we knew that if you don't capture these responses now, you will not get the same ones again later. So we look into software, we look into basically best practices for conducting interviews. So we got volunteers on board and we trained them over, this is the Zoom platform, as you can tell, and we trained them, we gave them tips on how best to conduct a Zoom interview. And so after our training, we actually are very happy with our volunteers. We have had over 40 of them conducting at least one interview, some of them multiple, but 40 of them conducting at least one interview over the course of the last few months. So what did we cover? So I mentioned all the different categories of people just now, but at the end, of course, there's the more general ones, which applies to actually a large segment of the population. So I wanted to just let you share some of the themes that we went through. So with oral history, as I mentioned, which is also different, how it's different from other kinds of interviews, is that there's a very rich sense of context. So we want to cover the general and personal background. And why this context is important is because there's not just anybody talking and giving the responses, or it's not just anybody talking and who's feeling this way and responding this way to COVID-19. It's a person with a specific historical background, personal background, specific kind of like upbringing, specific kinds of job, occupation, family. So all these things inform why they respond a particular way when COVID-19 hits. So that's one key thing about oral history. So there's a lot of rich context. So we cover background, we cover their pre-COVID-19 life. Then we take them through kind of milestone events, from the early news of something springing up, something amiss in Wuhan, to Singapore government imposing gradual measures. For example, calling the Oscon orange and whatever happened after that, panic buying, etc. To our neighbors moving with a kind of a lockdown first, the movement control order, to our own announcement of the circuit breaker, which is unique in the world, to its extension. So all this drama, right? Circuit breaker, then after the extension. And how do people live their lives during this so-called new normal? How do people experience milestone events? Because life goes on. Pandemic doesn't mean life stops. Life goes on. People try to socialize. How do they do that? People try to celebrate festivals, birthdays. People still got married. People still had to attend funerals. People still experience childbirth. How do we experience all these, milestone life events through a pandemic? On the other hand, you had other things happening outside of our homes. You had increasing cases in the dormitories, in the communities. You had measures from the government trying to alleviate and help people out, the budget. You had a pandemic elections and how that went. You had the safe reopening in phases, and then we had to take a step back more recently, and then now again trying to reopen. And in fact, now the next big thing, I guess, in our development is the recognition that COVID-19 will probably be endemic. And so the whole set of thinking changes in how we view our situation. We look at how we support the local tourist industry. We look at vaccination, which is ongoing and can be a very difficult and contentious subject. We look at ways of tracing people, ways of ensuring that we can do contact tracing and really tighten the circles around the spread of the disease. So I'm very glad to share with you that we've actually collected more than 90 interviews so far, and out of that, about half actually are available online. So I have a link there for you. There's a shortened URL there that you can check out some of the interviews that we've uploaded. So these are all the interviews that are open access. So the interviews have consented to us letting the public access them now. Of course, some of them might have certain restrictions, and those will not be available for public until the restrictions are lifted. I wanted to share now with you some of the interviews collected, but I don't want to give you the names, of course, because the names wouldn't be meaningful to you. But I thought of how to present this to you in a meaningful way. And so I just went with kind of like occupation or titles that they have. And you can see that one key thing about oral history and an oral history project like this is that what's really important is that we have a diversity of experiences. And why this is the case is because we want to hear from people who are not like us. We want to hear from people who do different things, who view the pandemic from different positions, right? Who experience it in different ways. And this helps us to then document and chronicle this particular situation we're living in much richer ways. And these are just certain categories. There are different ways of categorizing, but this is just one way that I thought would be useful to categorize them. So with that, I think what I want to do now to kind of round up the session is to let you listen to some of the clips. And also, I'll let you listen to some of them, and then I'll talk a little bit about them, like the kind of a commentary. So I intentionally not place photographs because I want you to listen to their voices.
So I remember the point of the interesting encounter. The first couple who were diagnosed positive from Wuhan, is charged by me. So I was in PPE, and cannot really see clearly. Then whole body sweat. In this place called Decon area. So I was I attend to this couple. And the lady, when I first take her temperature, her temperature was 39 plus. You don't see high fever patients every day. So it came to alert to me. This patient can be something happening going on with her. Then she told me she came from Wuhan. Then so I was like, first moment is like quite shocked. Then I was looking at myself, I'm in PPE, so it should be okay. Then after that, I think 2 days later, I read the news. The couple actually was positive.
Yep. So I mean, I love that line. The whole body is wet. It really gives you this sensual, almost sensation of the experience from the front lines, and that's what we want to do. We want to make sure that we are able to record history in a rich way, emotions, and something that's sensorial. So I always think about it. Imagine if we had done an oral history project of the 1918 influenza pandemic, right? What would the voices on the people be saying? But we didn't, and we well, there were no recording devices back then as well. So now when we are doing this project, can we imagine how, I mean, we can kind of imagine, or maybe we can't imagine how people 100 years later will think about us and think about our experiences. But what we do want to do is make sure that there are these things for them to listen 100 years later. Okay, so the next clip.
In terms of worry, it's going to be how then can I effectively conduct lessons? Because I think pre-COVID, you kind of have a picture, you kind of have an image or like an idea about how you go about doing things. And of course, given the teaching attachment and all that, you have actually, or I have actually tried doing these things in classrooms. So I know, okay, what works and what doesn't work. So my worry then is, of course, now with COVID, with the new social distancing measures and all that, how would an effective lesson look like? I kind of have no idea about it. Yeah. So once again, the uncertainty.
So what I really love about this is actually there's this frankness about this I don't know-ness. She's basically saying, I can't even imagine the future. You know, it's really interviewing someone in the middle of something, and they're trying to imagine what could emerge, but it's so difficult because they're stuck in the middle, with nowhere to go. So I thought this really captured very well, maybe that feeling that might be familiar to some of us.
I think for me, mentally, I am able to cope thus far, perhaps due to the adjustment from blindness. Yeah, because I lost my sight like 5 years ago. To me, that was more traumatic, and it has helped me to adjust to daily living. Yeah, because blindness is really a lockdown and still a lockdown from the material world. But because I have many good friends and feeling support by them, I don't have to feel locked in.
Yeah, so as you can tell, Miss Tu is visually she's blind. I really was very touched by this interview actually, done by a volunteer, and particularly this quote, because it really reminds us of the experiences of the less vulnerable, and that what we're going through, or at least what I'm going through, I can only speak for myself, is nowhere compared to what some others might go through. Yeah, so I think it's such a valuable and kind of enriching means of actually remembering that there are so many people in our communities with different experiences, and some of them might need help, and we really need to make sure that they are all supported. And this idea of a lockdown, I mean, some people, sometimes also, we at home we might have felt bored, but we need to remember that others have it worse than us. Okay, so my concluding slide really, COVID-19 is unprecedented, affects us in many ways. I think while I said that history has certain narratives and there are very many different factors, will COVID-19 actually, do you think will be forgotten in history? I guess there's always different levels of probability. And for me, I would say that probably probability is low because there's such strong feelings and such strong consensus, and so many factors, right? It's supported by many kinds of factors that where COVID-19 is very high on agendas. So in a way, we do have this sense that COVID-19 is unprecedented. It is a historical moment, and we want to remember it. Documenting a historical event means a commitment to recording, collecting, and then long-term care and preservation. And that's, of course, coming back to where I work, of course, with the archives and the National Library Board. It is that sense. Some people think that, oh, I'm going to upload this video on YouTube and then it's going to be archived, in a way, a layman way of putting it. And there are many gaps in that logic, because things that you put on the web or the internet or on YouTube particularly does not mean that it's archived, because there's no commitment to preserve them for the long term, right? So YouTube is a private company. They can delete the data. They can start to charge you a lot of money to watch the videos, etc., etc. We don't know what happened. So the commitment to keeping it for the long term is really something that lies usually with the public service, with national bodies. Thirdly, oral history itself is unique means to garner in-depth first-person experiences. I hope I've sold that to you. I've always sell this idea that oral history is very valuable and that we should use more of it in the right way to achieve all these things that we want. Fourth thing is that crisis oral history is something that's a bit different from what we normally do, but it's very valuable and it's very important for us to capture those raw emotions and fresh memories before they fade. And not just because memories fade, but also you notice that over time, our understanding of things change because of other factors, maybe external factors, maybe internal factors. So it's valuable to take stock of them at different stages if that's possible, that's feasible. And one thing about doing an oral history interview early on is that coming out of an event, people respond to it very personally. Whereas in retrospect, people actually have other considerations sometimes. People think about actually whether their own version of the story or their own narrative gels with maybe more public narratives. Some people will take on public narratives for their own, right? So by getting to people early, sometimes we are able to get their ideas and thoughts while they are still fresh and maybe not so much influenced by things retrospectively or things along the way. And last point is that COVID-19 oral history is one that will help us make sense of what we're going through, as we are all going through, and can possibly teach us how to do things better. It's something that we can listen, we can then revisit over time. It's a public archive, meaning to say that we invite academics, journalists, members of the public to listen, understand, learn, share, and ultimately it's something that can be helpful to people in helping us also understand our own experiences, what we're going through. So with that, I think I'm just in time. I thank you for your kind attention and I hope that was helpful to you.